Well, 5, excuse me. Sorry about you two over there.
Great. Well, good morning, everybody. For those of you that I haven't met, my name is Gabby Ruggiero, and I'm a program planner at Behavioral Health and Disability Services, focusing on coordinating our opioid settlement fund. And I have a background in treatment, prevention, and harm reduction, and I'm excited to bring this work to the county. So we're going to briefly go over the funds as a whole and then where we're going with a strategic plan of how these funds will be spent over the next 2 fiscal years. So the first big question that I usually get is how much money are we going to receive? And for Iowa's share of the settlement litigation funds, we will get 50% for the state, and then the other half goes to the local share, which is the counties. For Polk County specifically, we will receive at least $17 million. This is, on paper, we're for sure getting $17 million, but we can estimate that we will get $20 million, maybe upwards of $30 million. The reason that it is not a certain number is because there are some companies that are still in litigation, or they might be going through bankruptcy court. So we're really unsure at this time. There's a lot of moving parts. For what we have in the bank right now, we have about $4 million, and by the end of the year, we'll have roughly $8 million. And then through 2029, we'll receive 1.5 to 2 million per year. But beyond that, we don't have enough information to estimate what our revenues will be. So you may know that the state did not decide to do anything with their share of the funds through this legislative session. There are a handful of projects that have been moved forward, like the billion pill pledge at Broadlawns to reduce opioid prescriptions to surgery patients. But other than that, those funds are just sitting at the state waiting to be spent.
Gabby, for sure, all of those funds that are, and you might not be able to answer this, that are sitting at the state, does that all have to be done legislatively?
Yes, so last legislative session, they passed a bill that said they would be in control of that funding. So it used to sit with the Attorney General's office, and now they have full legislative control. There was a bill to change the administrative process for that, but ultimately they still will have the final say in how it's spent.
But they still have a say. Unfortunately, they just have to do some legislation for it.
On the state's money.
Right.
And that's the legislation that didn't pass the last.
Right.
Correct.
Where we highlighted the, CFR. We're hoping to get that 8 million, and they didn't get it.
Right. Right, so of the 50% of the local share, Polk County receives 22.8%. So we are by far the largest entity that's receiving settlement funds, and most other counties don't have dedicated staff working on this. So we are in a unique position to show the state the projects that we're doing and how this money can effectively and strategically be spent. So what can we spend this money on? There are guidelines set forth by the National Opioid Settlement Trust that it must be spent on strategies to prevent further opioid misuse and address the effects of those injured by the opioid epidemic. Now, we know that opioids are affecting folks that are using all substances. It's across the illicit drug market. So while there's specific language about affecting people who have an opioid use disorder, we can generalize that people who use substances can benefit from the programs that will be set forth by these funds. There's not a lot of oversight on how we spend, but we do report to the Attorney General of Iowa and the National Opioid Abatement Trust. We work with County Attorney's Office, Auditor's Office to make sure that all of that reporting is done. And for how we decided to go forward, we first wanted to look at community needs. So last year there was a workshop with cross-sector leaders to bring everyone together to talk about gaps in the criminal justice system specifically in Polk County. You might have heard about the SIM workshop or the sequential intercept modeling workshop. And from there we got a rough idea of what the needs are in our county, and then we looked at this list of strategies that's in the settlement and went, okay, how can we use the settlement funds to address the gaps in Polk County? And then from there, I wrote a strategic plan that encompasses those gaps, as well as an additional priority area that I will talk about. So we do have some ethical obligations in regards to spending these funds, because we are getting them because folks are dying from opioid overdoses and have been affected by these pharmaceutical companies. And so I put together a list of guiding principles for us to consider as we make decisions about how to spend the money. And these are adapted from the Johns Hopkins School of Public Health guiding principles, which are nationally accepted ethical guidelines on spending the money. And then I adapted it based on that workshop that we did and Polk County's needs specifically. So first, we want to make sure that we are centering people in the decisions that we're making. As I mentioned, that's the whole reason that we're receiving funds. The second is that we want to make sure people with lived experience are involved in both the planning and decision-making process, as well as the programs that we fund. And this is something that, from that workshop of leaders, came about as a really big theme, that we need to make sure that peers are involved. The third is sustainability, and this is something that Annie talked to me about in the interview and on day one, that these are one-time funds, and so we have to think of them as a way to start up programs and create investment instead of supplanting existing funding for other programs. And that means that we should not look at them as a sole funding stream for any project. There should be a braided funding approach, and we should look at things that will be self-sustaining over time. The fourth is we want to use evidence to guide spending. So there are some projects or programs that we know do not help people who use drugs. There's a lot of research to show some things work better than others, so making sure we're consulting the research, and then also looking at what evidence shows we need here in Polk County. And then the last is focusing on racial equity. So about 4% of Iowans identify as Black or African American, but they account for 13% of the overdose deaths in Iowa. So we want to make sure that we have an equity lens on looking at organizations and projects and doing intentional outreach to underserved communities that are affected by substance use. So let's dive into the strategic plan priority areas. There are 4 of them. The first is deflection and pre-arrest diversion, which came about from the SIM workshop last year. So in Polk County, we have diversion programs that are focused on mental health in the jail, and then we have drug court, family treatment court, but we want to look at diversion efforts before folks are incarcerated. So either pre-arrest, so they are going to a program instead of going to jail, or deflection where there might be a community referral or a police referral to a program if someone is potentially using substances. And that would be in coordination with the Sobering Center and other projects that are already existing. And there's a lot of different directions we can go with this. We're in conversation with the county attorney's office about what they're interested in with diversion work. And we've been in discussion with a couple different national models. You might have heard of the LEAD model. And for looking at a full-scale implementation in Polk County, they estimated that it would cost about $500,000. And so to start something small and pilot it and put $250,000 towards a program and then look at grants that could supplement that work is the direction that we want to go. The next priority area is recovery housing. And Folks in the SIM workshop identified that housing first is a critical piece of substance use recovery, and we know that there is a lack of affordable permanent housing, rapid rehousing, and permanent supportive housing in Polk County from a couple of studies that Homeward initiated in the past year and a half. So recovery housing, anyone could call a house a recovery house. So we want to make sure that we're identifying organizations that are doing evidence-based practices. It might be a peer-ran space where several people who are in recovery live together and maybe go to groups together, or it might be a more formal space where a social worker is embedded in that house and they provide more structured services. And because we have a lot of great housing providers, we want to have a broad grant process where folks can have innovative solutions to the gaps we're seeing in recovery housing specifically, and provide a one-time grant of $1 million in the next fiscal year to give infrastructure, to go towards infrastructure costs and startup costs. So if they have that startup funding to build out a house or to build a program, then potentially rents or other revenue streams could sustain that service. The third priority area that came out of this SIM workshop and in the criminal justice gaps was jail reentry. We have a lot of great programs happening at the jail, but unfortunately sometimes people fall through the gaps, especially if they're using substances, and maybe we're receiving services while in the jail, but then trying to get back to those community providers after they're decarcerated can be a struggle. So we're in conversation with jail administrators about different strategies that could help these folks, including expanding medication-assisted treatment for people with opioid use disorder in the jail, as well as providing peer and patient navigation when they're leaving. So that might be working with third-party organizations in the community that can help provide those services and be that warm handoff essentially, and help that person get the help that they need. And there are a variety of other grants and funding sources that we are actively exploring to supplement this work, but we could go a lot of different directions. It just depends on what the priority is for the jail and the sheriff. And the last priority area are the grants that were rolled out last week. So we know that this is a critical pressing need. You know, there's a lot of discussion about how this money is sitting at the state. Well, we have the opportunity to get the money out into the community very quickly. And while those other three priority areas are looking at changing structure for long-term change, we also wanted to have a pot of money that focuses on direct supports for people with lived experience. So maybe that's getting people transportation to go to treatment. Maybe that's more of that harm reduction approach, like what the health department is doing, and making sure there's safer use supplies available to folks. So these are grants that are going to go to organizations to help people who are actively using, potentially get into services, or keep people in recovery or treatment, And the funding cycle for this will be this year. We'll have 5 projects that will be awarded $200,000 over 2 years, and then next fiscal year there will be a second round of funding for the same amount. So in total there will be 10 projects that will be funded at that $200,000 mark, and then we've also set aside $150,000 to expand current initiatives with the health department surrounding harm reduction and preventing disease transmission and overdose deaths. And I have a picture here of one of those harm reduction boxes. If you haven't had a chance to look at them, they're at River Place and in front of the health department, and if you have a code, you can punch it in, and they have hygiene kits and most recently menstrual products, but then also resources on how to reuse syringes so folks do not prevent the transmission of bloodborne diseases if they're using drugs. So beyond the strategic area the next fiscal years, there are some additional planning initiatives. When we look at the allowable expenditures for opioid settlement funds, it's not solely focused on the criminal justice system, although we've done a great job of identifying those needs. Treatment and prevention are really critical to helping people who've been affected by the opioid epidemic. But with the behavioral health redesign at the state level, we're not sure what the future of publicly funded treatment and prevention efforts will be. And so right now we're in a planning and assessment phase of knowing that those services will need to be funded by opioid settlement funds in some capacity at some point, but we're not ready to go into implementation with any projects until we first see what that redesign looks like, but then also see how the state wants to spend their funds, because based on the legislation I saw, they are going to want to direct most of their funds to treatment and prevention, and so Polk County can then fill the gaps in those other strategies that the state does not want to fund in our community. We also have, we know that there's a need to look at how youth can be benefited from these settlement funds, and that's something as a department we're looking at, as well as making sure that there's opportunity for public input. There's communities that are already receiving scrutiny because they're spending the money behind closed doors, or they're spending it on things that maybe are not in the spirit of the funds. And so we have a webpage up on the BHDS website where we've posted the strategic plan and the grant applications to make sure that people know where we're spending the funds. And then the last thing, input from people with lived experience. I'm going to work with the health department to do focus groups with people who are in treatment and recovery about what services could have benefited them to get them into treatment, or what was critical for them to stay in recovery, to further that comprehensive approach of knowing what the needs are in our community specifically. Does anybody have any questions?
I got a couple.
Great, I knew you would.
A really good presentation. The deflection and pre-arrest diversion.
Yes.
We've got diversion now out of the jail.
Right.
So tell me exactly how this would work for opioids.
Yeah, great question. So it might be helpful to look at that flow chart there on the slide. So right now we have diversion happening at intercept 2 and 3. So when people are booked at the jail, we will cross-reference with BHDS's system to see if people are receiving mental health services, and then we can deflect them out of or divert them out of the jail if we know that they are potentially there because of a mental health issue. And then we have special courts for people who use substances. However, we want to look at intercepts 0 and 1. So before people are even taken to jail, there's an opportunity for them to be put into a program that might have a variety of different requirements. It might be that they have to get a substance use evaluation. They might have to do the treatment that was prescribed to them in that evaluation. It might be that they have to meet with a case manager. So if someone is using a substance and they have a low-level misdemeanor like possession, having paraphernalia, public intox, some type of trespassing charge, instead of having those charges or being taken to jail, they complete some type of program and in a community-based setting, and then they don't even get to the point of being in the jail and having those diversion services there.
Places where we could place them?
So that's a great question. It depends on what type of program we want to pursue. So it might be working with community-based providers that already exist and do similar work. It might be creating additional infrastructure in the county to do this programming. It just depends on what we think is best. And I know the county attorney is interested in post-booking or post-arrest diversion work, because that's more of their realm. But we would be looking at, again, before that person even has a charge on their name.
How does this intersect with Bridges of Iowa, that program?
Yeah, so Bridges would be a program that would happen again, after that person has been seen by the court and put into the criminal justice system, and they go to that court-ordered treatment. But instead of involving them in that system, whatever type of treatment or community-based programming they would do would happen outside of the criminal justice system.
We want to get them before they get a
Right,
charge.
Right, but I'm just wondering if, at some point, could they apply for one of these grants? Would they be eligible for this fund?
If Bridges wanted to work in that pre-arrest or deflection space, but what the key partnerships will be with law enforcement. So making sure that we have those partners is going to be the most critical, and then thinking about who would be providing that case management or treatment-related service.
That they are post.
Right.
And then, the recovery housing.
Yes.
It could be like a group home, for instance,
Right.
which we're giving one up, apparently, which might have worked. But it has to have supportive service wrapped around it. So could it be a treatment center of some sort? Could they go to a treatment center?
No, it's a different,
Whole different
it's a
deal?
different beast, yeah. So there are some recovery houses that are associated with treatment centers in Polk County, but this is a separate independent space that is either maybe supported by that treatment agency in some capacity, or it's completely independent of treatment altogether.
Is it sober living?
Yeah, so generally, yes, it would be sober living houses. There are some houses that might work in more of a harm reduction model and balance that housing first. That's so important with making sure that it's a safe space for people in recovery. But generally, yeah, when you think of sober living homes, it's the same thing as recovery housing.
Are there organizations in Des Moines doing this now?
Yeah, there's a lot of organizations that are already doing this work. Kingdom Living's pretty extensive, has a lot of homes. The Beacon, Bernie Lorenz, these are just the ones I can think of off the top of my head. But they range in a variety of supports. So Kingdom Living mostly has that pure RAN space. So it's a house with several people who maybe go to groups together. They have a house meeting that they attend every week, whereas the Beacon has a variety of supportive services with different types of housing. So they might have a case manager that they're required to go see, where they talk about how their treatment is going.
They be eligible for these funds?
Yep, that's right. So any organization that provides recovery housing would be eligible. But again, when we're thinking about narrowing the scope of who we want to see receive these funds, it's for folks that have sustainable programs, and they're looking at other funding sources, and we're giving them startup funds so they can potentially collect rents or find other revenue streams down the line.
Are we gonna do an RFP for this?
Well, I talked to Ryan about this, and he said that the type of projects that we're looking at do not require the RFP process, because we are giving funds to another entity, and then they are providing that service versus providing that service on behalf of the county. So, no, this would be a grant process. Obviously, with this type of, or this amount of funding, we would be working with Andrea and making sure that there's some oversight along with it.
So, since it's a grant and a contract of some sort, is the board gonna look at this?
Absolutely. So everything that is going to be funded through the settlement dollars will ultimately be approved by you all. So,
You have a committee of some sort to, similar to our regional governing board, which is gonna go out the door apparently with the new behavioral health redesign. But some kind of committee that will look at some of these to make sure that we agree with what's, it's a lot of money we're spending,
right.
that we have a say in any of this.
Yeah, absolutely. So,
We're not experts, by all means, but I do think that, some of us have a soft heart for some of these things, and we want to make sure that how we're spending our money. We're very disappointed that the state did not get that resolved, because this would have been very helpful in line with what we're trying to do here, so we know what path we're going.
Right.
And now we're taking the cart before the horse, I see, which is not how we wanted to go.
Mm-hmm.
So I'm a little, I'm not sure that's really what we wanted to do.
No, you don't want to duplicate efforts, that's one of the things that we discussed when we
I
were
know,
going through the
but this
settlement.
is kind of what, I understand we want to do something, but if the state was going to do that, and you say, you know, clearly they might want to go to another path, but I
Yeah.
don't trust really what they say.
I agree with you.
Writing what they're going to do, and now they didn't give out that money. So, I don't know.
And we may be spending our money on something that they're
That they were gonna do.
Or they're gonna roll out next year, and it's
Like
like.
the infrastructure money.
Yeah,
That's a
yeah,
perfect example.
Yeah,
That just, you know, it just sort of
yeah,
really screws us up.
it does.
It really does.
Yeah, I agree with you. When we look at the pre-arrest diversion and jail reentry projects, most likely they will not fund those things at all. With the recovery housing piece of it, again, we don't know, but looking at the legislation that they proposed for the recovery housing or housing infrastructure, the amount was so little that it really would be a drop in the bucket. And so if we start with this and then see what they do, this is not a guarantee that we will do this $1 million again, for example. So the reason why the strategic plan is limited to through fiscal year 26 is that exact reason, is that we don't want to get ahead of ourselves here, and we do want to wait and see what the state does, which is why we're not even getting into the prevention and treatment piece right now.
We're taking the little nuggets and trying to figure out, you know, where we can make the most impact, knowing that the state's not going to do touch the criminal justice stuff or whatever else you mentioned.
Right, yeah, and with the needs that we identified in Polk County, it just happened to be that we focused on criminal justice to start, and so we've said to these community members that, yes, we are going to focus on those 3 areas, while also having those smaller grants for the immediate harm reduction, saving lives, getting people into treatment projects, and then hopefully next legislative session we'll have more direction from the state.
Gabby, I have a question related to a program the sheriff was talking about the other night, where when they move somebody from the jail to release them, they do it with medication and assistance and medical care, so that they're just not leaving the jail without assistance. Does this program help them for, you know, providing those medications and some of the costs associated with that?
Yeah, I see it as an expansion of that existing project. So right now, the medications that folks are receiving are related to mental health and physical health,
Yep.
but things like medications for opioid use disorder are not being given to someone before they leave. There's some special guidelines and restrictions with them, but I see it as an expansion of that warm handoff, or making sure people
Yeah.
have those medications.
So would so those, I mean, is that built into this plan? Those dollars built into this plan?
Yeah, so right now I'm working with Chief Williams, and the sheriff has made it clear that the medication piece is a priority for the jail, to expand the medication-assisted treatment program. And so a part of that might be folks receiving injectable medication before they leave, so that they have time to connect with a treatment provider. It might be that they receive a short script in order to get them to a community provider. So definitely a priority area within the jail for these funds.
Okay.
Yes, John?
So, budget question, back on your guiding principles and sustainability.
Right.
You say the settlement funds should not be the sole funding stream. Is this a Fund 10 expense? I mean, are we looking at, where was that heading? Was that heading towards general fund expenditures to supplement this? Just curious from a long-term budget impact.
I see what you're saying. So it'll depend on the project. So when we're talking about things like housing, there might be state money, there might be grant money, but maybe when we're talking about something like pre-arrest diversion, the cost savings that will come about are proven in many communities. If someone implements a program such as this, the cost savings to the county are well known. And so potentially, if we use this funding to pilot a program and we can collect data to show what the long-term savings will be, then we could look at how could public dollars and county dollars supplement a program like this long-term.
And that would just, those dollars would be pumped back into Fund 10. Is that what you're saying? Because we can't use Fund $10.
No, this is not Fund 10. So it would be reinvesting the county dollars that are freed up into these programs if they're, I mean, that's what we're going to test to see if that's possible. Other services could be paid for by Medicaid. So if we can get them off the ground and then transition them over to a Medicaid funding source, that would be an option. So everything that we're doing, we look to see what can we do in the future if this funding isn't there. To make sure that we're not creating something and then in 5 years go, okay, now how are we going to pay for it, or do we have to just end the program? We don't want to do that, and so
We've been down that road before.
yes, we have. So we are not anything that we do. We want to make sure that we have a way to pay for it in the future, and so we're looking at grants, we're looking at Medicaid, we're looking at all different types of things. It could be in the future because we don't really know exactly what the behavioral health ASO is going to allow, but we're taking on we would be taking on the substance use piece for the state. We may be able to utilize some of those funds to sustain these programs. We won't know that until we see the RFP and the contract for the behavioral health ASO. So we don't want to get too far ahead and get things up and going without really knowing exactly how we're going to be able to fund it. But all of that is in the back of our minds as we are creating everything.
And it sounds like in the meantime, you're going to document where this can save money that would justify
Yes.
either full or partial investment of that savings into continuing the program.
Yep. Absolutely. And for the MAP program, specifically the medication program at the jail, we, as an office, already work with the University of Iowa to evaluate our programs, and so I've been meeting with her to see how we can do some collective data or some comprehensive data collection so that we have a nice source of seeing how we can leverage that data to apply for some big federal grants, because we looked at some federal grants for this coming fiscal year, but there are a lot of requirements for them, and so if we can collect some comprehensive data, not only will it show how it will save the county money, but we can also use that data and ask for federal funds as well.
This is one heck of an opportunity, really.
It is, and we are receiving these funds through 2038 or 2039. I'm not sure with the newest settlement what their payment plan is, and so I think folks have a notion that, oh, it's long-term funding, right? But they're just breaking up their payments over time, and we really need to be in the mindset that these are a unique opportunity with one-time funds to kickstart some really good programs in Polk County.
Gabby, do you have any data yet on the continuation of care or the medicated assisted treatment program that the jail has already started regarding recidivism, any of those people that are being given that continuation of care, given that medicine before they are released and being connected with a provider outside of the jail, or started collecting that data?
So we do have some internal data that I know is being gathered as we prepared to apply for a grant that we are no longer pursuing, which I can follow up on. But as far as seeing if people are connected to those community providers, that's a difficult data collection point, because that means you have to be following that person and checking in with them long term. And so if we have those patient navigators or community navigators that are helping with reentry, they can be those folks that can follow up with the people that are leaving the jail and collect that data.
I'm looking at it in terms of more, are they coming back?
Right. Recidivism.
They're tracking in the community, but if they are released on Wednesday, May 1st, and given all that continuation of care, are they coming back? You just see if they're relooked.
Right. Yeah, and I'll follow up with Dylan on that and see where we're at with collecting that data. I'd be interested to see as well. They started in 22 with the MAT continuation program and have had roughly 10 people at any given point in that program. NAFCARE estimated that we could easily see 50 people in addition to that just to start as a pilot, with upwards of 200 total in a MAT program in the jail, which is pretty staggering. And so making sure that it's an effective program with what we're already doing is an important piece, Ralph, and I'll follow up with you on that.
The other interesting thing, Ralph, is the sheriff talked the other night about, the work they're doing with St. Vincent de Paul on the reentry, and he kind of indicated they've got some good data on that, on what they're seeing in terms of returns. And the other thing he talked about was the, this kind of the second chance program for reducing felons' charges if they are released with the understanding that if they're ever convicted again with a gun, that they're looking at that program, then they throw the book at them. But if they're able to go out and live among the community without coming back or any gun-related crimes, then they get like a second chance. It's sort of a, it's
a carrot.
Yeah, it's sort of.
Just don't carry a gun
And he said
again?
that they're working with the county attorney on how that would work, but, so those sounded like, because I think St. Vincent de Paul is tracking reentry numbers. At least they indicated that to me. If they're seeing repeat offenders that have
Out of the
been-
jail?
No, that have left the jail and gone into the
gotcha.
reentry program.
Okay.
The reentry program that St. Vincent de Paul is where they're getting them a job,
Right.
getting them a down payment for their deposit for their apartment, and then having them, get on.
Their life together.
Yeah, so, and they're checking to see how many of those reoffend or end up back in
Well,
the
that's good
system.
data collection.
Yeah.
Which you probably get too from St. Vincent, I suppose.
Haven't seen it from St. Vincent, but get it from them.
But if we're already doing it with the mental health piece, probably we'll see how many of those people got back to jail. So you can try to fit on to the work.
That's really doable.
I wonder when you're gonna step up.
So a couple things. I appreciate you mentioning, that's the WARN program, and that'll be in front of the board for next Tuesday, and that is a grant-funded position. It funds about 75% of that position to work on the gun issue that you mentioned when those felons get out. So we're excited about that program. Never done it before in Polk County. On the Medicaid-assisted treatment program, the Sheriff's Office would really like to see that prioritized with these funds, because we do have a continuation program that has been successful, but we have significant room to expand, not only to 50, but up to 250. I think it's important because the county will likely be spending dollars on that anyway. We're already spending money on medications anyway. So this could really offset current expenses. And then we've been working with St. Vincent de Paul, and what we would like to do is develop a kiosk in the lobby of the jail. So when these folks are released, they can instantly meet with someone that can service right there. And I feel like that program would be successful in reducing recidivism. And then also what we would like to use some of these dollars for is an additional discharge planner. Our current one we've had a ton of success with. We need another one. The demand is there. And I think it's I think it's really valuable for these dollars because the county will likely spend that money anyway. And so we're gonna incur those expenses. We are incurring those expenses currently, so it's a great use of this money. Obviously, I'm biased and I know there's other needs, but in order to really reduce recidivism and help these people, if we can get them the treatment they need while they're incarcerated, it's going to help greatly when they get released back in the community.
But you have this in place now, or after episode in place now, say, this person was put into the continuation care MAP program, endorsed by the state, and got some sense. Is that tracking being done?
No, and in part because that needs to be tracked in a more significant amount of time. So this program really needs to be in effect so that the sample size is larger. But anecdotally, I can tell you, yes, it affects recidivism. It reduces recidivism. Anytime you're getting people the treatment they need, that is the key. That's the silver bullet in all of this to reducing recidivism and enhancing public safety.
I give the sample size of time bigger, but right now, somebody tracked,
Yes.
signed up, and is there a flag?
Yes. Yeah, and so my hope is by the next CJCC, we'll be able to present some of those numbers.
Because the only way we get additional dollars on grants is you gotta have the data.
We'll have the data.
That's right. Yeah.
We will.
And I think working with the University of Iowa and looking at that comprehensive data collection will be really critical for those big federal grants that'll supplement all of this work. We could spend all of this money on any one of these areas. So again, thinking about how we can be strategic is really, really critical.
Okay,
Good work.
yeah, thank you. Any other questions or anything for anybody?
One more.
Okay.
Magical about the 200,000? I mean, is that, how do you arrive at that number, or is there something, if somebody comes in the great program with more, needs more, I mean,
That's a great question. So it's not a magical number, John. $100,000, not enough for folks to do effective work, but $200,000 would allow someone to hire a staff member, for example, or do some type of fund for people who are in treatment or in recovery. And then looking at the total number that would be spent with those 5 awards of $200,000 and thinking, okay, we want to set aside $1 million for one funding round and then $1 million for another is just a starting point. But what I would like to see with these smaller projects is if folks are piloting a program that is very successful and they're showing us outcomes, that down the line we can say, okay, these are some projects that have been very successful. Let's give them an opportunity to apply for continuation funding. Right now, when we're looking at all of the moving parts, that's not something that's explicitly said in the strategic plan, but that's a great question.
And when you talk about the 200,000 pays for a person, you know, always when most of us anyway, feel when we give out these grants, no matter if it's a development grant or a betterment grant, we hate to give out for people,
Yes.
operations, because that's not sustainable. you
Yes.
know, Unless it's a long-term, forever kind of thing. So that's something else we always look at.
Yeah, I am skeptical of funding staff members, as I know you all are because of that reason. There are some special circumstances that I can envision where folks could potentially, again, collect data, have a pilot program, and then be able to fund that person long-term. But yeah, staff members, there will be some additional scrutiny on those applications for sure to see how they're going to be sustainable.
Right. Okay. Thank you.
Absolutely. Yes. Thank you for your questions. And you can reach out to me directly at any time.